What's up, guys? It's Anissa Holmes coming on to do a FB Live with you guys. I am so excited about today's topic. Today we're going to be talking all about how you can guarantee that your patients will accept your treatment plans without even spending a dollar. So I'm really excited about this training. I actually recently did this training with my team inside of my practice, and they were just like, oh my gosh, they were blown away. So I'm really excited again to share this training with you guys. And this training is actually going to transform your practice. So it's going to be super, super exciting. Now, let me just first, before we go into the strategy of how you can achieve that, let's just talk first a little bit about the false beliefs that many dentists have in terms of how they can get patients to accept their treatment plans, okay? So many dentists believe that you have to spend a ton of money to get people to actually come into their practice and accept their treatment plans. However, what is actually true is that once you understand how to communicate with your patients, you really don't have to spend a ton of money, right? The patients that are inside of your practice, you can go ahead and get them to accept that treatment, and that will be highly converting, and you can achieve all of your production goals for your practice. So that false belief being that you have to spend a ton of money on marketing, you have to get new patients over and over again, it's really not true. Right? So for those of you guys that are just joining me, we're talking today about how you can really guarantee that your patients accept your treatment plans, again, without spending any money. And again, I'm just super excited to share this with you guys. So if you guys are excited about this training and you want to know exactly how you can do that, make sure that you're giving me lots of love, lots of likes, and hearts, and let me know where you guys are following me from, okay? The other thing too is you want to make sure that you're subscribing to this broadcast. I'm going to be coming on a ton in the future, giving you guys lots of amazing training, and so you want to make sure that you are subscribed so that you are notified when I come on live, okay? So that's the first thing. So again, we're talking about those strategies to be able to grow your practice without spending a ton of money. And the first false belief is that you have to spend a lot of money, or you have to focus on new patients, right? It's simply not true, right? So the second false belief that people have about growing their dental practice is that they, again, have to have a lot of different strategies, right? You have to be focusing on continuing education to get profitability inside of your practice. You have to be focusing on SEO. You have to be focusing on Facebook. You have to be focusing on so many things, right, to grow your practice. And again, the purpose of a business, for those of you guys that are business owners, is to be able to over-deliver, to serve your customers. In our case, it's our patients, right? And when we do that, what happens is that they are happy. They become raving fans. They are so thrilled to have all of the services that we offer that we really don't have to try to convince them. They just want to be there, right? And so you really don't have to be focusing on so many strategies. Again, what we're talking about today actually doesn't cost any money. So if you guys are excited about that, tell me, let me know that you're excited. So let's get down to that strategy. All right, if you guys are ready, let's go ahead and get to it. Okay, so what I want you guys to understand is that what you can do to get your patients to accept your treatment plans, I'm really excited. Right, so what you can do is you have to think to yourself, for anything that you're trying to explain to the patient, anything that in your mind you feel that they need or can benefit them, you have to think to yourself, what is it that this patient has to believe is true in order for them to want to do that service today? All right, so let's break that down. So let's talk about sealants. Okay, so what I asked my team when we did this training this week is I asked each one of them individually, if you were coming in as a patient and I was a dental hygienist and I was talking to you about having sealants done, right? And what would I have to tell you? What would you have to believe is true in your mind in order for you to start that sealant today, right? So is it going to be that, and these are the responses that they gave me. If we don't get a sealant done, we're very likely going to get a cavity. One person said that. The next person said that, I would have to believe that it doesn't take a lot of time, right? Because I don't have a lot of time. The next person said, okay, I would have to believe that that it's really easy. It doesn't hurt, right? The next person again said that they thought that, or they would have to understand that, again, if they get sealants, the likelihood of them getting a cavity is really, really low, right? And so that's what they would have to believe is true, all right? So anytime you're really looking to get patients to accept treatment, you have to think, right? So say, for example, you're recommending a crown. And you can do this exercise with your team. The same exercise, again, I did it with my team last week. You ask them, what would you have to believe is true, right, for you to want to do a crown today? And I can tell you there are times when patients come in my practice and they have a filling and it has a crack in it, right? So I have an option to say, well, you can come back and you can have that crown done. Or I can say, oh my gosh, I'm very concerned. I'm very concerned because what I'm seeing here is a crack. There's a crack inside of the tooth. And I'm very concerned because this tooth can break. And if it breaks, we won't have the ability to fix this tooth. In fact, you're gonna have the tooth extracted. And then we're gonna have to look at doing a dental implant. So we'll have to send you to an oral surgeon. The process is gonna take 6 months. It's gonna be incredibly expensive. And so I'm very concerned, and I do highly recommend that you get this crown sorted out immediately, right? So what that patient would have to believe is true is that if they don't start that crown immediately, again, that day, then their tooth is gonna break, right? So again, what is it that people have to believe for themselves to make a decision that they're not leaving the office that day unless they get it done? Now, that doesn't mean that you have space in your office to actually start the procedure that day. But again, you're talking to a patient and you're communicating with them in a way that they understand that it's so important that they really should start today. Okay, so I hope that makes sense. Other examples are, dental implants. What do people have to believe is true for them to want to start that implant today, right? So what they have to believe is true is that if they don't get dental implants, that what happens is that the teeth can start to shift. And when they start to shift, then it's hard to clean. And when it's hard to clean, then you can have gum disease and the teeth can start to look long, and then the teeth can eventually become loose, right? And then in fact, in my practice, what I've seen in my own practice is patients who have not had replacements of missing teeth. They are the ones who are more often coming in for perio treatment, right? So again, I would encourage you do this exercise with your practice. I see we have an orthodontist on. Hello. So, in terms of orthodontist specialists, the same thing. What do people have to believe is true about the benefits that they get from ortho treatment in order for them to say, I want these braces put on today, right? And so when you start really thinking about that, you're gonna start communicating a lot better with people to say the right things. And what happens a lot of times is, as dentists, we are teaching, we are showing models, we are just giving people TMI, too much information, and really something called technobabble. So you're just talking and talking and talking about all of these technical details, and you're confusing people, right? And so what I want you guys again to do is really think about, when you're communicating with people, what do they have to believe is true? And once you start going through this exercise, again, brainstorming with your team and asking them, and that gives you, a really nice pool of people to give you that information of what people really would have to believe is true, then you can start changing how you communicate with people. So If that makes sense to you guys, say yes. It makes sense. Communicate. Let me know that you understand, because this is really so powerful. Because a lot of times, again, we're focusing on getting new patients. We're focusing on marketing. We're focusing on, do I have to do SEO? Do I have to do a blog? Do I have to do all of these things? And really, all we have to do is make sure that we understand what our patients have to believe is true in order for them to get started. So I hope that this training today, this Facebook Live, has helped you guys to develop strategies to grow your practice. It's really amazing, how we really didn't learn a lot of these strategies in dental school. And so, this is really my passion to get out there and teach you guys some advanced business strategies. And as a result of it, patients will get their work done and their lives will be changed. Okay, guys? So that's it for today. Really just a quick teaching lesson. I hope that you got lots of value, and I look forward to chatting with you guys again really soon. Take care.